Go.
Hi, this is Kayleen Elliott again. This is my informative speech for session 3. I have my coworkers here with me again today.
You did me. Okay.
Okay, and here we go. First slide, please. So, most of you know that Trinity, about 2 years ago, she had ruptured her anterior cruciate ligament, her left side. 6 months later, she had ruptured her right anterior cruciate ligament. So, at the time, there was 2 different surgical procedures that were offered. One of them was the tibial plateau leveling osteotomy. The other one was the tibia tuberosity advancement. She did have one of the procedures, and we'll talk more about that, which one she had and why I chose that procedure. But I just figured it'd be a good idea to research more about anterior cruciate ligaments, ruptures, and the procedures that are offered. Even though she already had done, figured it'd be a good idea to learn a little more about it. It's important, I think, this information because anterior cruciate ligament ruptures are one of the most common orthopedic injury in canines. And really, it can happen to any canine, so it's beneficial for any dog owner to know what they are and the surgical procedures that are offered to repair these ruptures. I'm ready yet. Thanks. I believe that, I would say that I am capable of presenting this information because I have worked for a veterinarian for the past 2.5 years that has performed many of these procedures, which he is now board certified in surgeries. And also that my dog, Trinity, she's had 2 of these procedures already. So, moving along. So, today what I'll be talking about is basically what an anterior cruciate ligament is, what anterior cruciate ligaments ruptures are, the signs of the ruptures, and how a doctor can diagnose them. Then secondly, I'll talk about the different procedures, the TPLO and the TTA, the surgical procedures that are used to repair these ruptures. And then finally, we'll talk a little bit about the procedure that I chose for Trinity and why it was best for her. Okay, next slide, please. First of all, an anterior cruciate ligament is the anterior cruciate ligament is one of the ligaments connecting the bones in the knee joint. Dr. Bowley had written in his unpublished manuscript, Surgical Repair of a Craniocruciate Ligament. The stifle joint is made up of the femur, tibia, joint capsule, joint fluid, medial meniscus, lateral meniscus, craniocruciate ligament, also the CCL, known as the CCL, caudal cruciate ligament, medial collateral ligament, lateral collateral ligament, transverse ligament, and surrounding muscles as well as tendons. So basically, the craniocruciate ligament is responsible for stabilizing the knee during weight bearing. Next is what is an actual anterior cruciate ligament rupture. The ACL, as I stated before, is one of the most common orthopedic injuries in canines. If it's left untreated, it can cause osteoarthritis, which is not good for any pet. Dr. Bowley also writes in his unpublished manuscript, the underlying cause of an ACL rupture is the biomechanics stress caused by a downward sloping of the tibial plateau and the relationship to the patellar tendon. A couple of the signs, as you can see in the pictures, I'll talk a little more about those. There are a few signs of anterior cruciate ligament ruptures. One would be acute limping, as my dog Trinity here is doing. She's limping. Another is difficulty rising and sitting, as well as mild weight-bearing lameness that may worsen after exercise, which was a really big sign for Trinity at the time because we'd go out for about a half-hour walk and she'd come back barely able to walk, which is a very abnormal for her. And then the last one is history of inability to sit normal, which in her picture here, you can see she's kind of sitting to the side. And she's been doing that forever, and I just thought it was normal until I brought her in and had our doctor take a look at it and realized there was more to it besides just the sitting abnormal. So now that we know what anterior cruciate ligaments are, what the ruptures are, and how we're going to talk next about how they actually rupture their canine anterior cruciate ligament. It could either be from an athletic injury, from running and jumping too much, just doing too much activity, or some canines are just predisposed to the ruptures. They can be diagnosed by either a doctor can palpate the stifle for any instability, but the final diagnosis would be through radiographs to determine if it is ruptured or not. Just picture my radiograph. Okay. That's great. So the next thing that we need to talk about is the different procedures that are offered to repair these ruptures. First would be the tibio-plateau leveling osteotomy, which Hilliker writes in Joint Problem That Makes Dogs Owners Weak in the Knees, a relatively new technique called the tibial plateau leveling osteotomy, or TPLO, involves breaking and resetting the tibia, the long bone below the knee, in such a way to remove the need for a cruciate ligament. This procedure has been around for about 12 years now, and has been proven to be very successful in most cases, and there's always certain cases where it's not, but for the most cases it is. Many veterinarians choose to use the TPLO because it offers a fast and full recovery. The other procedure that we talk about is the tibial tuberosity advancement. Levine and Rasmussen writes in the TTA versus TPLO, the biomechanics behind its success for correcting cranial cruciate ligaments is a change in the patellar tendon angle that effectively neutralizes the tibiofemoral shear that occurs during weight bearing. Many veterinarians choose to use this procedure because it has less post-operative discomfort, reddening, and swelling than any other ACL technique used that's out there today. Most canines recover faster with the TTA because due to the osteotomy, which is the bone cut, it's being in a weight-bearing area, so they're able to actually walk on the leg versus where the TPLO where they can't. So now that we talked about what cranial cruciate ligaments are, what the ruptures are, signs of the anterior cruciate ligaments ruptures, and how doctors can diagnose them. We also talked about the different procedures, the TTA versus the TPLO procedure, and then finally, the procedure that I chose to can't talk. Sorry. The procedure that I chose to go with training was the TTA procedure, basically because it was less technically demanding. The return function following surgery was much quicker, and the TTA did not affect her weight-bearing surface, which was great for her, basically because she is a very hyperactive dog, and it was the best suitable procedure for her instead of having her hold her leg up for a few weeks. She was actually able to walk on them. We started going for short walks about 2 weeks after her surgery. We started going for short walks, and then we progressed to our longer walks, and within 6 weeks she was back to her full recovery. And again, anterior cruciate ligaments, they're common in most, they're the most common orthopedic injury in canines, and there are a couple different procedures out there that are able to repair these ruptures, and the two main ones that are most popular today would be the tibial tuberosity advancement or the tibial plateau leveling osteotomy. And that is the conclusion of my speech. Thank you.